Today's topic is about the lung volumes. There are different lung volumes and we can derive the lung capacity using the different summation of lung volumes. The lung volumes are tidal volume, inspiratory reserve volume, expiratory reserve volume and residual volume. The lung capacities are inspiratory capacity, expiratory capacity, vital capacity and total lung capacity. The first lung volume is tidal volume. Tidal volume or TV is the amount of air that can be inhaled or exhaled during one respiratory cycle in normal or quiet breathing. The normal value of tidal volume is about 0.5 liters. We can forcefully inhale air on top of tidal volume. This is called as inspiratory reserve volume or IRV. IRV is defined as the amount of air that can be forcibly inhaled after a normal tidal volume and its normal value is about 2.5 liters. If there is inspiratory reserve, there must be expiratory reserve because everything in life needs to be balanced. An expiratory reserve volume or ERV is the volume of air that can be exhaled forcibly after exhalation of normal tidal volume. The normal adult value is about 1.5 liters. When we forcefully exhale, we feel that nothing is left, but in reality there is about 1.5 liters of air left, and this is called as residual volume or RV. Now we can play around with these four lung volumes to get other functions which I will go through now. First lung capacity is inspiratory capacity or IC. Inspiratory capacity is the total of tidal volume and inspiratory reserve volume. Similar to inspiratory reserve volume, the air you forcefully breathe out, which is the expiratory reserve volume, and the remaining air, called as residual volume, added together is the functional residual capacity. If we add the tidal volume, inspiratory reserve volume and the expiratory reserve volume, that gives us vital capacity or VC. Similar to VC, if we were to add all four lung volumes that are tidal volume, inspiratory reserve volume, expiratory reserve volume and the residual volume, that gives total lung capacity or TLC. Now, all these volumes will change in obstructive and restrictive respiratory diseases. Let us first see how these volumes are altered in restrictive disease. A restrictive disease means these diseases limit the lung ability to stretch. For example, pulmonary fibrosis, whereby the lung tissue are laden with scar tissues and thus it cannot stretch. This means the amount of air that you breathe in is limited or reduced. Similarly, the expiratory volumes are all reduced. In other words, every lung volumes are reduced and thus reducing the total lung capacity because the total lung capacity depends on the lung volumes. Now we will look at obstructive disease. An obstructive disease means something is obstructing the airway. In this disease, there is no problem with inspiration but there is problem with expiration. This means, the tidal volume and inspiratory reserve volume are fairly normal, but since there is an obstruction somewhere in the airway, you are unable to breathe out all the air that you inhale. There the extra air volume will be in residual space, causing the residual capacity to increase significantly. The increase in residual capacity is so much that it actually enlarges the total lung capacity. In summary, for restrictive disease, all lung volumes and capacities reduce. For obstructive disease, inspiration poses no problem, so the inspiratory reserve and tidal volume are of normal values, but there is problem with expiration. That means, the expiratory reserve volume is reduced because being unable to expire. These gases remain in the lung, increasing the residual volume. The residual volume is increased so much until the total lung capacity is also increased. These are some questions that can test your remembrance of the topic. Pause this video and try to answer them. That's all regarding lung volumes and capacities. If you find value in this video, please like, comment, and subscribe, as this will motivate me into doing more videos like this. If you have any biology topics that need discussion, send them via the Google form that I have linked below. Thank you and see you in the next video.